In this video, we're going to review the medical, pharmacy, vision, dental, and wellness benefits available to Mohawk Valley Health System non-union employees for 2016. First, let's focus on the medical plan. Here's how it works. We have developed a custom plan for MVHS non-union employees. It is a Preferred Provider Organization Plan, also known as a PPO, with both in and out-of-network benefits. What makes this plan unique is that, in addition to the standard in and out-of-network benefits, you also have a second in-network benefit called the Domestic Network. These Domestic Network benefits allow you to get services at any MVHS-owned facility or MVHS-employed physician at discounted copays. Here you can see the Domestic Network, in-network, and out-of-network costs. Because the Domestic Network is strictly a copay tier, there's no deductible. For in-network, there is a $1,000 deductible for individuals and the $3,000 for families, followed by 20% coinsurance. For families, there's a $3,000 in-network deductible, but there is a $1,000 deductible per individual within the family. You can think of it like an individual cap. So each person pays toward the deductible, and once any one individual reaches $1,000, like Tom has here, coinsurance kicks in for that individual, regardless of whether or not the family as a whole has reached the $3,000 family deductible. The rest of the family will continue to pay toward the deductible. What this means is that if one person is using the plan more than everyone else, they don't have to wait until the family reaches the $3,000 family deductible before their coinsurance kicks in. For out-of-network, there is a $3,000 individual and $9,000 family deductible, followed by 40% coinsurance. Don't be too concerned about these out-of-network costs, though. Because Excelis's Blue Card network is so expansive, about 99% of all claims go through as in-network. You'll want to take a close look at your plan documents for a complete list of the costs associated with the various medical services. But here's a few highlights of the domestic network and in-network costs for a few of the most common medical services. For a primary care physician office visit within the domestic network, there is a copay of $15. In-network, there's a $35 copay. For a specialist office visit, there is a copay of $35 for the domestic network and $50 in-network. For an inpatient hospital stay, there is a $300 copay in the domestic network, and you would be subject to the deductible and coinsurance in-network. All preventative services are covered in full, both in the domestic network and in-network. There's also what are called out-of-pocket maximums. The Affordable Care Act, also known as healthcare reform, mandates that health plans have out-of-pocket maximums on all health and pharmacy plans, meaning that there is a set dollar amount for how much you'd ever have to pay out of pocket for covered medical expenses within the plan year. These out-of-pocket expenses include your deductible, coinsurance, and copayments. It does not include your premium. This is a benefit to you because you know that you will never be responsible for more than this out-of-pocket maximum during the plan year. The domestic network benefits have a medical out-of-pocket maximum of $1,000 per individual. For families, there is an out-of-pocket maximum of $1,000 per individual with a $3,000 total family out-of-pocket maximum. For a family, the out-of-pocket maximum works exactly the same way as those in-network deductibles. In the domestic network, there is an out-of-pocket maximum of $3,000 per family, with a $1,000 out-of-pocket maximum per individual. Each person pays copays toward their medical expenses, and if they reach that $1,000 out-of-pocket maximum, like Jane has here, the medical plan will pay 100% of all remaining covered costs for the rest of the year. The rest of the family will continue to pay copays until either they've met their $1,000 individual out-of-pocket maximum or the family as a whole has reached the $3,000 family out-of-pocket maximum. Again, this means that if there's one or two people in the family using the plan more than everyone else, they don't have to wait until the family reaches that $3,000 family out-of-pocket maximum. Now, that's only if you stay within the domestic network for your services. If you do have to go for services outside of this domestic network, but still within the Excellus Blue Card network, so in-network doctors or hospitals that aren't operated by MVHS, you will have those in-network benefits. But keep in mind that the out-of-pocket maximum for these in-network benefits is larger than that of the domestic network. For an individual, the out-of-pocket maximum will be $3,000, and it will be $9,000 for families, with a $3,000 per individual cap. Note, though, that while the domestic network and in-network medical out-of-pocket maximums are represented separately, both domestic network and in-network services count toward the in-network out-of-pocket maximum. So, individuals will never be responsible for more than $3,000 out of pocket. So, you've got domestic network and in-network expenses. There's a $1,000 per individual out-of-pocket maximum in the domestic network and a $3,000 per individual out-of-pocket maximum in-network. But combined, your out-of-pocket expenses will not exceed the in-network out-of-pocket maximum. That's $3,000 for individuals. You'll pay co-pays when in the domestic networks, and you'll pay toward your deductible and then co-insurance in-network. Both will count toward that $3,000 combined out-of-pocket maximum. But once you pay $1,000 out of pocket for domestic services, your plan will pay 100% for any remaining covered domestic services for the rest of the year. You will continue to pay for any in-network services, though, until you've reached that combined $3,000 out-of-pocket maximum. Once that out-of-pocket maximum is met, the medical plan pays 100% of any covered medical expenses for the remainder of the year. If in-network services alone bring you to your $3,000 out-of-pocket maximum, then both in-network and domestic network services will be covered in full for the remainder of the year. It's important that you take a close look at your plan documents for more details. It's also important to understand what services are and are not within the domestic network. Again, domestic services are available at MVHS-owned facilities or from MVHS-employed providers. Please be mindful that some services, although physically located within our facilities, are owned and operated by another organization and therefore not eligible for a domestic discount. An example of this would be CMI MRI services and LabCorp or Centrex lab services. Though CMI and Centrex are located at some MVHS facilities, they are not MVHS-owned services and therefore not part of the domestic network. It's also important to remember that many providers have privileges to care for patients in our hospitals, but may not directly be employed by MVHS, and therefore they are not considered a domestic provider. An example of this would be anesthesiologists with Sunset Anesthesia or team health physicians in the emergency room. These providers are employed independently even though they practice within our facilities. For more information, please see the MVHS Domestic Services and Provider Directory, which is available on the MVHS intranet or from Human Resources. Okay, let's give you a couple of examples of how this plan would work. This is Sue. Sue works at MVHS and is on a family medical plan with her husband and 2 children. Sue will be having a baby at the MVHS Birthing Center in October. During her pregnancy, Sue has had some minor complications, causing her physician to send her for regular lab work. But because she is covered under this domestic plan, she is able to go to an MVHS facility to get her lab work done, and it is covered in full under the domestic network benefits. Sue has also had 15 doctor visits with her OB/GYN during her pregnancy. At a copay of $15 each, she is paid a total of $225 in copays throughout the year. When Sue has the baby, she pays one $300 copay for the birth and nursery care at the birthing center. If Sue had had the baby at a non-MVHS facility, the birth and nursery care would be subject to the deductible and co-insurance. All of Sue's out-of-pocket expenses for the year are within the domestic network, and they total about $525. Even combined with other medical expenses that her family incurs throughout the year, Sue and her family do not reach their out-of-pocket maximum for 2016. This is Joe. Joe also works for MVHS and is the only person on his health plan for 2016. While visiting his family in Buffalo in April, Joe gets into an accident on his bicycle. He is taken to the local hospital's emergency department, treated for broken ribs, and admitted to the hospital for 2 days. Since all emergency services are covered as in-network services, regardless of where they are treated, Joe will pay the in-network benefits. The hospital in Buffalo is actually part of the Blue Card network anyway. Joe later returns home and gets his bill and insurance statement. The cost of the entire visit and treatment in Buffalo totaled $25,000. Because Joe had not incurred any costs during the year prior to this incident, Joe is responsible for the entire in-network deductible, which is $1,000, and then the 20% coinsurance until he reaches the $3,000 out-of-pocket maximum. That means that Joe is ultimately responsible for paying $3,000 of the $25,000 in medical expenses. Once he's paid that $3,000, he's reached the out-of-pocket maximum for the year, and his plan will cover 100% of any remaining covered medical expenses for the rest of the year. So Joe also has a couple of follow-up visits when he returns home, as well as x-rays. Because he's within the domestic network, x-rays are always covered. But because he's already reached the out-of-pocket maximum for the year, all of his doctor's visits are covered in full as well. So Joe is not responsible for any more out-of-pocket medical expenses. Joe is still responsible for his pharmacy copays, though. When Joe left the Buffalo hospital, he was given a prescription for some brand-name pain medication, and when he got home, he had it filled by MyRx and paid a $15 copay. He will need to pay this copay because, though he has already reached his out-of-pocket maximum for his medical expenses, he has not yet reached his separate $1,000 out-of-pocket maximum for his pharmacy expenses. Let's look at the pharmacy benefits. Pharmacy benefits will continue to be managed by Broad Reach Medical Resources, or BMR. For prescription drugs, there are 4 tiers: Tier 1 generic drugs, Tier 2 and 3 brand name drugs, and Tier 4 specialty. Any prescription drugs that you have filled by the MyRx pharmacy at St. Luke's will qualify for the domestic network cost. That's a $5 copay for Tier 1, $15 copay for Tier 2, $40 copay for Tier 3, and 5% coinsurance for Tier 4. For any other pharmacy, you'd have a $10 copay for Tier 1, $35 copay for Tier 2, $60 copay for Tier 3, and 10% coinsurance for Tier 4. Just like the medical, there is an out-of-pocket maximum for your pharmacy costs. There is a $1,000 per person out-of-pocket maximum with a $3,000 per family out-of-pocket maximum. Note that this is separate from your medical out-of-pocket maximum. If you and your family choose to use the MyRx pharmacy located at St. Luke's to fill your prescriptions, you can save some money. MyRx is a pharmacy located at the St. Luke's campus dedicated to filling the prescriptions of employees of MVHS who are covered under the plan. Through MyRx, select generic drugs will be only $3, or the cost of the drug if it's lower than that. And you can get a 3-month supply of your maintenance drugs for only 2 copays instead of 3. You can even get some very inexpensive over-the-counter medications. To make it as easy as possible, there's a designated parking spot for quick MyRx pickups. And MyRx will even ship prescriptions through the mail for employees who want to take advantage of the savings but are unable to get to the St. Luke's campus. You can contact the MyRx pharmacy at the phone number listed here. Vision benefits are provided by Davis Vision. This benefit is bundled with the medical plan, so if you obtain health insurance through MVHS this year, you will automatically be enrolled in the Davis Vision plan. Note that you are not able to purchase vision as a separate benefit. Dental benefits are provided by Lifetime Benefit Solutions. You have 2 options, the base plan or the buy-up plan. And because you have this choice, the dental benefit is not bundled with the medical. MVHS is proud of our wellness program, Better Health, Better You. Linked to this program is another potential benefit to you that we want to mention. If you are enrolled in MVHS's medical plan and participate in the voluntary and confidential wellness screenings, you will receive $25 a month in additional benefit. It's as simple as that. If you are interested in participating but are not enrolled in MVHS's medical plan, contact Human Resources for more information about this benefit. The wellness screenings are conducted by Interactive Health. If you'd like to learn more or have questions about how to participate, you can contact Interactive Health at the number listed here. So what's next? Open enrollment for 2016 benefits will take place from November 6th through December 4th. Faxton St. Luke's healthcare employees will need to enroll online through MyHR. All Faxton St. Luke's healthcare employees must log in and enroll or waive coverage no later than December 4th. All St. Elizabeth Medical Center employees will need to complete and submit an option form no later than December 4th. If you're making any changes, you'll need to complete some additional paperwork. You can stop by or call Human Resources to obtain this additional paperwork. Note that even if you're waiving coverage, you will still need to complete an option form. All employees, both Faxton St. Luke's Healthcare and St. Elizabeth's Medical Center, who choose to waive health insurance for 2016 must provide proof of other coverage to Human Resources in order to receive the health insurance waiver stipend. We will be holding 4 benefits fairs in November. Here are the dates and locations. If you have any questions, do not hesitate to contact Human Resources.